Hello, everyone, and welcome back to Atlantic Coast Aesthetics. I'm Matt with ACA, and joining us once again is Dr. Thomas Pane, founder and chief medical officer of Atlantic Coast Aesthetics. Dr. Pane, for this question of the week from our Facebook audience, a person had a Brazilian butt lift done a while ago, and the question goes like this. They had a Brazilian butt lift done along with a revision to round out the shape a few years ago. However, after some weight gain, they've noticed that their behind section has gotten larger than they would like. They would prefer a more natural look. Their thighs don't proportionally look size up to their buttocks. Should they get laser lipo to help with that issue, or would exercise be the best choice in this case? Dr. Pane, what would you suggest?
Well, again, that's an interesting question. When we do the fat transfers to the buttocks, people want it larger, and it's amazing how few people say that we've made them too large. It's happened. I think my own statistics, it's something like less than 0.5%. So it's a problem that happens, doesn't happen too often. What happens when you transfer the fat is your body will gain or lose volume in the areas of the transferred fat as you gain and lose weight. So if it's transferred to the backside and then you gain some weight, the bottom will get a little bit bigger than it initially was when it was initially done. And it sounds like a second procedure had been done. Now, it is possible to do liposuction to the buttocks. I don't worry so much about laser lipo, non-laser lipo. Removing the fat and contouring it can be done, but because the issue came on after you gained some weight, it might be better to just see if you can get your weight back down, because that will allow you to change that shape without having to do a procedure to change it. Because sometimes things can get a little bit out of proportion, the legs are looking too small with the weight gain, and then there can be an interest in doing something there. So that would be my first suggestion. And if it does not work, or you need more contouring, you'll need to go to somebody that's comfortable doing suctioning, liposuctioning of the buttocks. Not everyone wants to do it because there is greater risk of getting skin irregularities. People that do a lot of this tend to do it. I do it. We have special techniques to try to limit the chance of getting into any issues. So that's what would be my suggestion. Try the weight loss first, see how things go. Keep the surgery option on the back burner. Laser, not so important, but an experienced person, consult with an experienced person, more important.
Great. Thank you, Dr. Pane. And if you have a question for Dr. Thomas Pane, please visit our Facebook page or website. And Dr. Pane, we appreciate your time, and we'll see you next week on the next question.
Great.